Hi, this is Janine Noble, and I with Sound Sports Imaging. Welcome to our latest webinar. Malka is off traveling right now, so we're wishing her a fun vacation, and we'll see her back in a couple of weeks. I am here today with Dr. Dr. Charles Finch from Midwestern University. Malka and I have been working with Dr. Finch and the staff here at getting, what am I trying to say here?
Really setting up a whole curricular model for ultrasound.
Yes, that's exactly what we're doing. As you know, Malka was an administrator with Gateway University or Gateway College in the ultrasound program for many years. And that gave her an in. She had met Dr. Finch through there. And from that, we have worked over the last several years to get this program integrated, starting with faculty development and working for that. So I'm going to let Dr. Finch, how did you get started? What is some of your background, first off?
Well, first, Janine, thanks for having me and appreciate the opportunity to be here as well. I'm a board-certified emergency physician. I've been in practice for just over 20 years, practiced here in the Honor Health System, formerly Scottsdale Healthcare, and also been on faculty here at Midwestern University at the Arizona College of Osteopathic Medicine for the last 15 or so years. And
he doesn't look nearly old enough to have been doing that.
Thank you. But, I had the opportunity really a few years ago to be able to identify a need. And the need in our curricular model here at ASCOM is to look at how we're integrating ultrasound in our curriculum. When I was a resident back in the mid-90s, ultrasound wasn't even part of the residency model for physicians going through graduate training. Now, it's actually standard of care for emergency physicians that go through emergency medicine training. And there's other disciplines out there that actually have that integrated into their graduate medical education model as well.
Do you know which ones in particular are doing
critical care? So critical care, general surgery, emergency medicine, those are the three big key areas. Okay. Anesthesia in some programs as well. Pediatrics, family medicine, internal medicine really still hasn't found its niche in the curricular model yet. It's a matter of time.
Yeah.
And so for me, practicing as an emergency physician, I'm out in practice. I'm actually caring for patients that are critically ill. I'm utilizing ultrasound, but I wasn't formally trained in it. Residents that are coming out now are. I thought it was important to look at what are we doing here in our curriculum to actually prepare our students to become also not only successful residents, but also successful physicians. And so 3 years ago, I embarked through through our dean's office. They came to me and said they wanted to help support ultrasound in our curriculum. At that time, we were teaching 3 hours of ultrasound in a family medicine small group, and that was it for a 4-year model. And so the need was there. We identified stakeholders. We looked at different stakeholders within our curricular model, within our faculty. And again, there was very limited amount of trained ultrasound clinicians within our faculty at that time. So I identified 3 key areas in the first year of our medical education. I identified anatomy, physiology, and osteopathic manipulative medicine, which is more of a musculoskeletal area that was of key, which is really a key area not only across our curriculum, but also certainly within our first year model. And so we looked at those 3 key areas to start.
Can you explain what the manipulative medicine entails for those who may not be familiar with that?
Osteopathic medicine does allow, again, students that are graduating from osteopathic medical schools are trained. It's a 4-year training program similar to the allopathic training, although we do have an additional modality that's set up within our curriculum, and that's osteopathic manipulative medicine. And it takes a look at the structure of our body and how the structure is related to the function. And so with the use of manipulation and various manipulative techniques, we integrate the basic science model of medicine with manipulation together to actually treat our patients as a whole person. And so, and it really does fit quite well with ultrasound.
It does.
So 3 years ago, we embarked upon identifying how are we going to start this within our curriculum. We identified key stakeholders within our curricular model that I had just mentioned, and I reached out to the community because I thought it would be important for us to work together as an interdisciplinary team within our community. And that's where I was able to be very fortunate. And I was able to land 2 key adjunct faculty now for us. Both,
and who would those be?
Both Malka as well as you, Janine. And I'll tell you, the success that we have had over the last now 3 years has been tremendous. And it's not even 3 years. We're really 2.5 years into this.
I know. So, and how did we start? You want to tell them about we started with a faculty development series.
That's exactly what we did. So we started right up with, after identifying key stakeholders within our faculty, we started with a year-long, once-a-month faculty development series. We identified key areas that were important for faculty to become aware of. And when I say faculty, I'm not just talking clinicians.
Right.
We had basic scientist faculty from anatomy. We had basic scientists from physiology, and we had clinicians come together and work together as a team, both with you guys, with us, and with our administration, because they were supportive of this as well.
They were very supportive.
To really begin to understand how to integrate ultrasound into our curriculum.
Right. And those first couple of times, we've talked about that before, we had a hard time getting participation. I mean, they come to the course, but a lot of them, this was a brand new thing. And it's always hard to do something new that you don't, and participate in something you're not familiar with. So it was hard to get them to hold the transducer.
I think starting at the basic level.
Yeah.
Identifying how to just turn a machine on, basic knobology, and understanding that, change isn't always easy. Although, as educators, we can always learn something new.
Yep.
And so how can we come together and take experienced sonographers and experienced therapists and work together to be able to integrate a new method into an existing curriculum? And that's essentially what we did.
Yep. And where are we at now with this?
Well, we spent the first year just getting people on board, getting them to have a good understanding of how ultrasound could augment the stethoscope at the clinical level, and how ultrasound could augment teaching in an anatomy classroom. And how can we teach anatomy with the cadaver and show basic imaging with the ultrasound machine and integrate that together to really augment medical education.
Mm-hmm. Absolutely.
So after our first year of teaching a faculty development series, 2 years ago, then we started with ultrasound in the classroom. And we did it in those 3 classroom areas: anatomy, which was year-long, physiology, which was about 6 months, just a bit less, and then osteopathic manipulative medicine, which again was a year-long course as well. And what we did is we brought those faculty that were participating in our first faculty development series, we brought them together in the classroom, and we presented ultrasound imaging and ultrasound technique to our students to help augment how they taught in the classroom. We had students imaging each other in the basic science level, seeing what is normal, just like we do when we introduce radiology.
Right.
What is normal? How is anatomy seen from a cadaver, and how is anatomy seen from an imaging perspective? Wow, it was phenomenal because the students actually learned, I think they learned more. We actually went back after the first year and we surveyed the students, and they, certainly from a grading perspective, they did very well. And from a survey perspective, they felt that this integration of ultrasound into the curriculum helped augment their learning in a way that they felt was extremely successful. Now, again, this is first year students. They didn't know what to expect before they came in. The interesting part is the students that were already in their second year were actually somewhat jealous.
Jealous, yes.
Because they felt like they were maybe missing out. And I would say they're not missing out, because we're giving them an opportunity, because we all can teach each other. And that's what we've learned, because the first year students that learned after the first year came back as second year students to help teach the first years.
Right.
And so then we began to build upon clinical faculty, basic science faculty, and students. And how could we actually continue to build that cadre of teachers to help us continue to integrate ultrasound into other areas of the curriculum within our college? And that's what we did during that second year and beginning now into our third year. It's interesting though, because now in our third year, we have the opportunity to now reach out to other colleges across our campus. We are one of about 9 colleges here on campus. And so physical therapy, podiatry, physician assistant, nurse anesthesia,
veterinary,
just to name a few, and veterinary, absolutely. Yeah. We've actually now reached out to additional stakeholders in these other colleges to try to identify ways that we can work with them to integrate ultrasound into their curricular model to help augment the stethoscope there as well.
Right.
Interestingly, too, is that it also teaches us the opportunity of how we can work together as an interdisciplinary team.
Yes.
Because as an emergency physician, when I'm out there caring for patients, it'd be nice to really have a good idea of what a physical therapist does,
Exactly.
what a podiatrist does,
Yeah.
what a pharmacist does, a veterinarian, etc.
Yeah.
And also, how can ultrasound be a part of that?
Yes. Now, a couple of things have come from this too. There is an ultrasound club on campus that has grown quite a bit. I know we did some stuff right at the very beginning, but they have turned into quite a major club here on campus.
It started as an interest group. And again, when I mentioned key stakeholders in that first year from a faculty perspective, I really should have also mentioned there was some key stakeholders from a student's perspective. The students want this to be part of their curriculum. They've actually talked of this from the very beginning, not only talked it up, but have showcased the energy, interest, and passion to really make sure this happens. And so that first year, we had an interest club that was set up with about, a good dozen students. And they worked with us directly, helping us be models, as I had mentioned before.
Yeah.
And then the administration has actually now approved last year an ultrasound club where they actually now fund through student services an ultrasound club to help support the needs of our students and ultrasound across the curriculum.
And they come back for these different courses that are being taught too. They come in and serve not just as models, but as proctors, as mentors in their teaching assistants. And the students have picked it up. We're just tremendously impressed with their knowledge and just how they have embraced this.
I think, in addition to their learning of the material, what it's done is it's allowed the students to really become very excited about really, I think, new ways to deliver medical education. When we talk about delivering anatomy or physiology, for example, it's not just reading out of a book, and it's not just looking at a cadaver and identifying body parts per se.
Right.
How does this interaction occur real time with ways that we can help begin to better understand our own bodies, and how can we work together to do it? And ultrasound has made that happen. And it's an easy, I think, cost-effective, relatively speaking, resource-driven opportunity.
Right.
We started here with 2 ultrasound machines and 250 students and no budget.
Yeah. Tell them how many ultrasound machines you have now.
And in 2 years, we've been able to increase our number of machines up to now 18 machines. And when I say 18 machines with 3 probes, 3 each, and about 4 to 6 simulators that we use starting in the second year, but certainly in the third and fourth year, to help us identify pathology. Because in the first and second year, when we're imaging each other, it's mainly imaging normals.
Right. Yeah.
And then near the middle to the end of the second year, we begin to then image abnormals. Mm-hmm. And certainly in the third and fourth year, so for example, when they go out to do OBGYN,
right,
they'll come and do a pre-rotation module where they're actually utilizing ultrasound imaging with a simulator, doing vaginal probes and identifying not only dating of pregnancy, but then identifying ovarian cysts, ruptured ovarian cysts, ectopic pregnancies, etc. Similar to how we do it in general surgery, where we may come in and talk about identifying a pneumothorax, or doing identifying what is a fast exam. We actually can go into the lab now and ultrasound with the use of a simulator and image an abdomen and identify with the use of a fast exam abnormal pathology. Yeah. So these students are now being able to go out and provide, I think, a good quality of the care that they're going to provide, not only the students in their third and fourth year, but I think it better prepares them to become a successful resident in the programs that they're actually intending to do.
Absolutely.
I think the school is seeing some advantage because students now that are coming here to apply, actually many are seeking this school because of this integration of our ultrasound into the curriculum.
Right.
So I think that's one key advantage that the school has had. And the second key advantage, I think, is that we're preparing our students to become the most successful residents and ultimately the best physicians that we can be.
And there's someone who's going to be needing their services and, pretty much in the next couple of years. We want to know that they're the best equipped. Now, another thing that we did this last year was an ultrasound elective, where we ended up with 11 or 12 students for a quarter?
It was for 10 weeks.
For 10 weeks,
Mm-hmm.
yes. And had that come in that we went through all of the point of care. We went through musculoskeletal. So we were able to, they came out very well equipped and very knowledgeable.
Certainly, there's we have 250 students per year in each of our classes for 4 years. And obviously not all 250 students are going to have a keen interest in ultrasound. They all will be provided the same basic ultrasound curriculum across the 4 years, but there are many that want more. And so those that want more, and it may be interested students that may be interested in critical care, internal medicine, some, even emergency medicine and general surgery, for example. We set up the opportunity this last year, as Janine said, where we now have an ultrasound elective for them. So we take them a little bit further along into their curricular studies to help them better augment ultrasound within not only the curriculum, but also within point of care across, many different specialties. We're doing the same this coming year for our third round of our faculty development series. So this upcoming year, we're actually going to do point of care ultrasound teaching for 4 hours once a month. Actually, it's once every other month with our faculty. And so that'll be, I think, an interesting approach.
That will be. Well, and some of this is the ARDMS, the ultrasound governing body, and the APCA, which is a part of that too, has developed a point of care ultrasound certification program. If you haven't checked that, you can go to apca.org, I think, and it will give you all the details on that. But the physicians can become certified in various areas. First trimester pregnancy, vascular,
point of care where they're doing
abdominal,
central lines, abdominal, right.
So it's a certification, so you can show your knowledge and your expertise in different areas, and that's what our goal is, to help them lean toward that, so that they become certified.
And again, I think anytime we have the opportunity to become better learners, will ultimately help become better practitioners in caring of our patients that we're seeing as well.
Absolutely.
And that's really the win across the board. 4 years ago, I probably would have questioned, gosh, is this going to sustain and become successful? I would have probably had the thought. I wouldn't have necessarily questioned it, because I think if you can get the right people that have the interest, the passion, and the willingness to actually move forward, I think anything is possible. And here's a great example, I think, of how we can take a machine and take that machine and really identify ways to augment learning, augment education, and provide better care for our patients. And that's what we've done. And I look at it as an opportunity to say, I'm going to wear a stethoscope and I'm going to have a probe. And between that stethoscope and probe, I'm going to be the best emergency physician I can, but it's going to take the whole team to do it. And that's what I think we've shown.
Right. We'd also like to thank Dr. Randall Neidham, who has also, along with Dr. Finch, been instrumental in getting this program started. He was off busy doing dean activities today. So
he's our associate dean for academic affairs. He's a basic scientist and an anatomist. And so I think, I was fortunate to have Dr. Neidham step up with me and say, you know what, this is an important endeavor. And this is something not only do we want here at our school, but how can we actually spread this not only with our students, but within the community as well. And so I think we've got a great team, and that's what we're trying to do. And I think we've been successful in doing it. So I appreciate the work that Malka and Janine have done for us and with us, and I also appreciate the opportunity to have our administration see the need as well. So
we're just very, very happy with how this has gone, and the future of ultrasound there's no limit to it. Yeah. So thank you very much. Thanks, Dr. Finch. We appreciate you coming in, and we will see you next week. I'm not sure what we're doing next week. I think it may be peripheral nerves.
Wonderful.
But we'll see you then. Thank you very much.